real estate market in the state of Tennessee. And of course, the attorney Reddick has already given us some information relative to the real estate market in the state of Tennessee. And now let us see if we can say something about health and perhaps later on some additional information in reference to some of the things that you're doing, Attorney Reddick.
Okay, sure. Well, you know, there's this health care bill. It's will be debated intensely. And the state of the health care policy right now, it's just, we are in desperate need of healthcare reform. I mean, there's absolutely no question about it. And when I look at and I think about what the president is trying to do, and there's so much opposition, you know, to what he's trying to do, because whenever you are taking on the powers, you know, that be the insurance companies, there is going to be tremendous opposition, you know, because obviously for there to be a public option, which allows for a healthcare marketplace, you know, for individuals to have choice and small businesses to have choice. You know, no longer they're the monopoly. What you receive is extreme opposition to that, and that's what the president is going through. But what I'm hoping, because this was an essential part of his campaign and what he ran on and what I believe he was elected to do, is to do what he thinks is right, and is to vigorously pursue healthcare reform. And I believe that it is going to happen in some form. Whether or not he gets all of what he wants, I don't know, but I believe that the majority of what he wants, he will, because it's about to come to a vote. And just want to say a little bit about the process in the Senate, because there is this reconciliation that would entail pretty much going ahead and bringing it to a vote with 51 senators. You wouldn't have the 60. You wouldn't have the requisite 60. And the question is whether or not that's a good idea to go ahead. And I've heard politically it's not a good idea for him to do it, because it would be the equivalent of somewhat ramming the legislation down the throats of the American people. But you were elected. You know, I said you, President Obama, was elected, and one essential part of your platform was health care reform, along with bringing the troops back. But that's something, another story. And that is what the American people are expecting, health care. So you have this coalition of blue dog Democrats, you know, which consist of mostly Democrats in the South, you know, conservative Democrats that are hearing that, no, we don't want the public option, we don't want government-run health care, we want to keep government away from health care. But my belief is that if some version of health care is not passed, that 2010 is going to be a lot more reminiscent. It's going to be very reminiscent of 1994, when you had Newt Gingrich and Republicans to come to power on the contract on America. It's going to be a lot reminiscent, more reminiscent of that. So something has to be done, and that because the system is broken, it doesn't work. You know, the premiums are too high, you know, with the co-pays, and, you know, with people with pre-existing conditions are not being able to, you know, receive coverage. And so something needs to be done, you know, to fix it. And his proposal, by and large, you know, it's not perfect, you know, but by and large, it is good because it gives Americans choices. You know, there are tax exemptions for, you know, small businesses, and it requires employers to provide the insurance coverage for their employees, so they will be covered, and that's a benefit. So all in all, on balance, you know, it is a good program, and what he was elected to do is to pass health care reform. And if President Obama and the Democrats cannot get it done, then it shows, I think, the American people that you can't govern. So the opposition, biggest argument is that, no, you don't need to do it. And for those of you that support it, you're going to pay a big political price. At 2010, I think they understand that if it's not done, that the Democrats will pay a huge political price at the polls in the midterm elections.
So you think the American people are ready for some kind of health reform? Do you think that's general? Do you feel that? I mean, that's the way I feel. I feel that something has to be done.
Yes.
Yeah, and whether it's this bill, somebody will have to pass some kind of legislation dealing with health, because so many people are without health
Yes.
care. I mean, without insurance, without whatever, and et cetera. So very good.
And, yes, uninsured and underinsured. You have people that do not have sufficient coverage with their insurance as well. So I mean, it's almost complete unanimity that something needs to be done.
Okay,
you
good.
know, the question is what?
Very good. And of course, I think that as an attorney, what are some of your thoughts in reference to these policies?
Yes, I feel that the president should vigorously go after and say whoever it is that is not supporting health care reform, like I say, in particular with Democrats. So you've got consistency across the board. You're going to have even Olympia Snowe, the more moderate Republican from Maine. She is not going to support the public option, but she will support health care reform in general. So I don't think there's going to be one single Republican vote for health care reform.
You think it's going to be, they're going to refuse to become involved to that extent, that they're not going to become involved at all? Is that?
Well, and the thing that's disappointing about that, it's one thing to oppose and to say this is not the best idea, we can do better, but put something on the table. You know, propose something instead of just use the Socratic method and say, well, we won't propose anything ourselves, but we're just going to, you know, point out all of the flaws with what we see, with what you propose. Absolutely.
And so in a real sense, real estate and health are two of the most important issues that the president has to face now in reference on the domestic part. And I think you've already indicated that it's a real problem dealing with our foreign policy, and especially in Afghanistan.
Yes.
And bringing all the troops home. But health, you believe, really are the health and the real estate market, you think, can really lead us out of this great recession that we're in. That if things are right in those two areas,
yes,
then we can possibly weather whatever other problems that we might have in this country. That is unemployment and et cetera. Would that be your assessment of it?
Yes, and he will not have an opportunity to focus in on unemployment until the health care bill, you know, and health care reform has been taken off the table. And that is one of the reasons why I'm not sure that it's going to be done in this year. But you made an important point when you mentioned Afghanistan. Right now, since 2001, we have spent roughly $915 billion fighting the wars in Afghanistan and Iraq. Now,
how much is that?
You can, as far as Pell Grants, as far as providing health care and additional police officers on the street and so many other services that you could have provided with that amount. You could have taken care of so many different domestic issues with that amount. And foreign policy is extremely important. It is important to make sure that the troops have what they need to be successful. There's no debate about that. But what at some point, now there's a request from one of his generals to send 40,000 additional troops over to Afghanistan. And he's getting a lot of slack for, okay, why hadn't he made a decision? But when you're making a decision whether or not to send men and women in harm's way, it should be deliberate. It should be a decision that is well thought out. We can see what has happened when we've had knee-jerk decisions and the commander that didn't really think things through, you know, and how that's turned out. So I applaud, you know, in whatever decision he makes. My only thing is that he does what he feels is right.
And of course, Mr. Reddick, I think we're coming to the end of this show today. I think we've got about 35 seconds before the end of the show, but I think that's exactly what we wanted to deal with, you know, to talk about the housing market in the state of Tennessee. And you believe that things are pretty on the up and up, look pretty good for Middle Tennessee at least. compared to some of the other areas, but you're also looking for this rebound in reference to, and health, you believe, that will be one of the things that might also help get us out of this situation. And of course, let us thank you for bringing by that information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.